professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, I am Dr. Sri Banerjee, core faculty for the College of Health Sciences at Walden University. The name of this talk is Let Your Voice Be Heard. And when I say this, I really mean it. It's your opportunity for your voice to be heard. It's true. The United States government is asking for you and me and others to provide written comments and evidence-based information on some really important documents and objectives that you should be paying attention to. So I'm going to start with the end at the beginning. I'm going to start with the email address that has been provided, and I'm going to then explain to you what you'll be providing comments for. You might be wondering, do I know enough to be able to provide comments? Should I be the one? And the answer to all of those questions is yes. Please review some of these documents that I'm about to provide about Healthy People 2030, and then provide your comments in this email. So what is it that you're trying to provide comments on? Well, let me, in order to explain that, let me go back a little bit and then explain to you some relevance of the Healthy People 2030. Well, there's actually a broad array of objectives, well over 300, in fact, over 350 objectives, and these are divided up into core objectives, developmental objectives, and research objectives. The main ones you want to pay attention to are the core objectives, and these core objectives, they generally have 5 specific components. Well, so, and why am I explaining to you what these core objectives are and how they were formed is because if you understand where they came from, then you can provide more informative comments. So I'm just going to give you a quick rundown. So number 1, it's important that they have a reliable, nationally representative data source with baseline that's no older than 2015. So that's important for this to be a core objective. We need to know relative to what the trends were before as to where we stand now as a nation. So having at least 2 additional data points beyond the baseline during the decade is also important. Of course, it needs to be of national importance, have effective, important evidence-based interventions available to achieve the objective. Evidence-based is very important. It's important that it's based in something we already know. And then finally, having data to help achieve and address disparities and achieve health equity. Very important focus, especially in this decade. And if you're forming core objectives, then you want to be thinking about those. Developmental objectives, they're not as stringent. There's high priority issues, of course. They do not then have to have that baseline that I was talking about in the core, but also needs to have, very importantly, evidence-based interventions to support that. And then research objectives, extremely important as well, but these are key opportunities. So these are areas that much more original research is being conducted actively, and areas of health or economic burden. These are prioritized, and of course myself and others, we are engaged actively in collaborative research constantly in the areas of social disparities and social determinants of health, which is so tightly connected with Healthy People 2030 objectives. These may or may not have reliable baseline data, kind of like the developmental objectives, and again, now in this situation you don't have to have evidence-based interventions because that is the nature of research objectives. So what's new? That was the background. What's new? What do you need to have comments on? Pay attention to this. So one of these objectives, one of these proposed objectives, has to do with disability and health. And so what it is that there is a proposal in the increase, pay attention to these, increase the percentage of adults who can resume 50% or more of pre-injury activities with or without supports, 5 years after receiving acute inpatient rehabilitation for traumatic brain injury. So this is very specific. Traumatic brain injury is on the rise. Many different aspects are being studied. Just today I was reading a study about how traumatic brain injury has been connected to a lot more mental illness among veterans, and so that have been engaged in work and have been engaged in shell shock. And so a lot of this new research is showing how has long-term consequences, which is why this is an important objective. So comments and any sort of ideas on wording changes, all of these things they are asking for. So I encourage you to take this, give this some thought, and provide some comments on how potentially you can better improve the wording or the terminology so that this can inform and capture what is going on. The second area is, of course, increasing the proportion of tribal communities that have developed a health improvement plan. So this is data source, Public Health in Indian Country Capacity Survey. So a lot of recent research. I actually recently had a doctoral graduate that looked at mental illness in the tribal community and also providing some guidance on that. So there's a lot of good research out there. I encourage you to look through some of the research, maybe do a Google search, take a look at this, see if there's some alterations in wording, and if this captures accurately what is needing to be found. The next part, of course, is something on infrastructure, which is essentially extremely important in terms of health access in many places. So increasing the proportion of tribal public health agencies, of course, that use core competencies for public health professionals in continuing education for personnel. So, of course, the previous one was infrastructure, but this one more specifically goes into understanding some of these competencies and increasing that alignment with the existing competencies. So this really focuses attention on this aspect of public health, and I think all of us can use another visit to some of these core competencies so that we can familiarize and remind ourselves of some of these things. And then, of course, there's additional comments that are being that are being requested, and this is especially important and just as important as the other ones because it's talking about evidence-based information regarding the relationship between voter participation and health as a measure of civic engagement. So this is extremely important, voter turnout, and all of these aspects are being much more closely studied due to the fact that there's a lot of understanding of how civic engagement has been in the past oppressed historically, and this has been a point of contention. And so there's been new studies, including some that I have completed recently. I recently ran an analysis which I'll share with you. This has not been published yet, but nonetheless very important. It's original research that I conducted using some of the techniques that I have been using thus far from Johns Hopkins University that I applied there in a unique technique there. So this is using Federal Information Processing System, and the technique is MGWR. And some of my other talks go into what that process is and in a lot of detail in how to complete that. But in summary here, I'm going to go into a little bit of the research that I conducted. And so state level FIPS codes have 2 digits, and then county level FIPS codes. So these actually have 5 digits. So 2 of them come out of the state code to contribute to that. So applying geographic weights, what was striking is the fact that there was actually voter turnout percentage significantly associated with lung cancer mortality. So in terms of mortality per 100,000, there was significant association. So this is striking, and especially there was variation in geographic distribution. So this really needs to be further understood. This was a bivariate analysis that was conducted, so more research needs to be done in a multivariate scale to explore other variables and confounding factors. So the next part of this is we need to find out what we need to do with all of this information that you just received, right? So what you should do is take some moments to look through some of the resources that I presented you with. And then go ahead, and I'm going to provide you with the link, and also in here provide you with the email, which is at the front of the screen. And you only have a little over 24 hours. So please get together, put some comments together, put some thought, and then email the Health and Human Services. Provide them with your feedback. This is your time to shine, to let them know what you think. And this will be part of the agenda that decides the rest of public health for the rest of the decade in the United States. Thank you very much.